It is the first week of January 2026. Margaret, a 72-year-old widow in Ohio, pours her morning coffee and sits down at the kitchen table. She has been waiting for this day all year. The government promised her a raise, a 2.8% Social Security cost of living increase. She did the math in her head a dozen times. She was finally going to afford her heart medication without skipping doses. She opens her banking app. Her hands are shaking a little, and then she stops. Her January deposit is almost exactly the same as December. In some cases, for seniors just like her, it is even less. No raise, no relief, just confusion, and a quiet, sinking feeling in her chest. Margaret is not alone. This is happening to millions of American retirees right now. And the worst part, the government did confirm it. They just did not say it loudly. I am Edward. I have spent years as a senior policy analyst helping retirees just like you understand the rules that quietly shape your monthly check, your Medicare coverage, and your retirement security. And today, I need you to listen carefully, because what I am about to share is not a rumor. It is not internet gossip. It comes straight from the Social Security Administration, from Medicare.gov, from AARP, and from the Kaiser Family Foundation. I am going to show you exactly why your January 2026 Social Security check may be smaller than you expected. I'm going to explain the official rule that caused it, and I am going to walk you through the 3 steps you must take right now to protect every dollar you have earned. But please, stay with me until the end of this video, because there is one hidden mistake, a mistake the government will never warn you about, that is quietly costing seniors hundreds of dollars every single month. I will reveal it before we finish. Take a deep breath. Get comfortable. Let us walk through this together. Let me tell you about Robert. Robert is 67 years old. He lives in a small house outside Phoenix, Arizona. He retired 3 years ago after working 41 years as a maintenance supervisor at a school district. He is the kind of man who pays his bills on time, balances his checkbook by hand, and trusts the government to do right by him. In October of 2025, Robert read in the newspaper that Social Security was giving a 2.8% raise. He smiled. He calculated his own number. His monthly benefit of $2,015 would go up by about $56. That extra $56 was going to cover the rising cost of his groceries. Maybe even let him take his granddaughter out for ice cream once a month. Robert did everything right. He filed his taxes. He paid his Medicare premium. He never missed a doctor's appointment. He even ignored the Medicare open enrollment letters because, in his words, I have the same plan I have always had. Why change it? That was Robert's mistake. When January 2026 arrived, Robert opened his bank statement. His net deposit went up by only about $38, not $56. That is because Medicare Part B quietly took $17.90 of his raise before the money ever reached his account. But that was not the worst part. Robert had not reviewed his Medicare Part D drug plan during open enrollment. His insurance company had restructured the plan. His monthly premium jumped from $42 to $89. That is an extra $47 a month coming out of his pocket every single month for a full year. Robert did not get a raise. Robert got a pay cut, and he had no idea it was coming. Robert's trap was not laziness. It was trust. He trusted that no news is good news, and that one small assumption cost him over $500 in 2026 alone. Do not be Robert. Let me show you exactly what is happening in plain English. Let us start with what the government actually announced. On October 24th, 2025, the Social Security Administration officially confirmed a 2.8% cost of living adjustment for 2026. This affects nearly 71 million Americans. For the average retired worker, that means your benefit rises from roughly $2,015 a month to $2,071. an increase of about $56. That sounds wonderful, but here is what they did not put in the headline. On the very same week, the Centers for Medicare and Medicaid Services released their 2026 cost fact sheet, and inside that document is a number that changes everything. The standard Medicare Part B premium is jumping from $185 per month in 2025 to $202.90 per month in 2026. That is an increase of $17.90 every single month. In percentage terms, that is nearly 9.7%, more than 3 times the size of your Social Security raise, and it does not stop there. The Part B deductible, the amount you must pay out of pocket before Medicare covers anything, is rising from $257 to $283. That is a 10.1% increase. Now here is where most seniors get trapped. They believe something called the hold harmless provision will protect them. Let me explain what that really is. The hold harmless rule, written into Section 1840 of the Social Security Act, says your net Social Security check cannot go down from one year to the next because of a Part B premium increase. That sounds protective. But there is a catch. Hold harmless only triggers when your dollar raise is smaller than your Part B dollar increase. For 2026, the average COLA raise is $56, and the Part B increase is only $17.90. So for most retirees, hold harmless will not protect you. The premium will be deducted in full. And hold harmless never applies to 4 groups of people. First, anyone who pays the IRMAA surcharge for higher income. Second, people brand new to Medicare in 2026. Third, dual eligibles whose premium is paid by Medicaid. And fourth, anyone who pays their Part B bill directly instead of having it taken from their Social Security check. Now let us talk about IRMAA. This is the income-related monthly adjustment amount. If your income in 2024 was above $109,000 as a single filer or $218,000 as a married couple, you will pay extra for Medicare in 2026. At the very top bracket, your Part B premium can climb to $689.90 per month, not $202, almost $700. And here is the cruel part. IRMAA is based on your tax return from 2 years ago. So if you had a one-time income spike in 2024, maybe you sold a house, cashed out a retirement account, or received a pension lump sum, you are paying the price in 2026. Now let us talk about Part D, your prescription drug coverage. The national base Part D premium for 2026 is $38.99. The maximum deductible any plan can charge is $615. But here is what KFF, the Kaiser Family Foundation, confirmed in their 2026 analysis. While average premiums are stable nationally, individual plans are restructuring aggressively. Some Part D premiums have more than doubled this year. Just like Robert's plan jumped from $42 to $89. There is one piece of good news. Starting in 2026, your total out-of-pocket prescription drug costs are capped at $2,100 for the year. This is a new protection under the Inflation Reduction Act, and it applies automatically. If you are on expensive medications, this could save you thousands. So let us add it all up. For the average retiree, your $56 raise becomes about $38 after Part B is deducted. If your Part D premium also went up, that $38 can vanish entirely. For low-income seniors with smaller benefits, the raise disappears completely. And for IRMAA payers, the math gets even worse. This is why I said in the beginning, millions of seniors will get less in January than they expected. And the government did confirm it. They just buried it in fact sheets nobody reads. But you do not have to be one of those seniors. Let me show you exactly what to do. Here are the 3 exact actions you need to take. Write these down. Pause the video if you need to. Step 1. Pull your official 2026 benefit statement directly from SSA.gov. Do not guess your January deposit. Do not rely on what your neighbor told you. Go to SSA.gov, log into your My Social Security account, and download your 2026 COLA notice. It shows your gross benefit, your Medicare deduction, and your exact net deposit. If you do not have an online account, call Social Security at 1-800-77-21213 and request the notice by mail. Knowing the real number is the first defense against panic. Step 2. Review your Medicare Part D and Medicare Advantage plan immediately, and use Form SSA-44 if your income dropped. Even if open enrollment has passed, you may qualify for a special enrollment period if you moved, lost other coverage, or qualify for extra help. Go to Medicare.gov and use the official Plan Finder tool. Compare your 2026 plan against every other plan in your zip code. If you find a cheaper one and you qualify for a special enrollment, switch. And if you are being charged IRMAA, but your income has dropped because of retirement, the death of a spouse, divorce, or losing a pension, file Form SSA-44 right away. This form can lower your premium by hundreds of dollars a month. Most seniors have never heard of it. Step 3. Check if you qualify for a Medicare savings program or extra help. If your monthly income is modest, the government may pay your entire Part B premium for you. The Qualified Medicare Beneficiary Program, the SLMB program, and the QI program all exist for this reason. And extra help, the low-income subsidy, caps your prescription drug copays at just $12.65 per drug in 2026. The Kaiser Family Foundation estimates that millions of seniors who qualify for these programs are not enrolled. They are leaving thousands of dollars on the table every year. Apply at Medicare.gov or call your local state health insurance assistance program, known as SHIP. The help is free. The application is short. Do not assume you do not qualify. Find out for sure. These 3 steps take less than 1 hour, and they could protect thousands of dollars of your retirement income in 2026. Now listen to me very carefully, because this is important. YouTube does not always send you notifications. The algorithm decides what you see and when you see it. By the time a critical Social Security or Medicare alert reaches your home screen, it may already be too late to act. That is why I created the Global Senior Alerts Official WhatsApp channel. It is completely free. You will not be charged a single penny. When you join, you will get instant access to our Senior Benefits Protection Guide, a free downloadable document that walks you through every Social Security rule, every Medicare deadline, every IRMAA bracket, and every pension protection law that affects you in 2026. You will also receive real-time alerts the moment something changes. New Social Security rulings, Medicare premium adjustments, bank account protections for seniors, insurance claim updates, even airport travel rule changes for retirees over 65, straight to your phone. No algorithm in the way. Click the link in the description below this video right now and join the channel. Download your free guide, take back control of your retirement. And before you go, if this video helped you understand even one thing about your January 2026 check, please give it a thumbs up. Leave a comment telling me your state so I can prioritize alerts for your region. And share this video with one other senior you care about. Maybe a brother, a sister, a neighbor across the hall. Because chances are they do not know any of this either. You worked your whole life for these benefits, my friend. Nobody is going to protect them but you. I am Edward. Stay informed, stay protected, and I will see you in the next one.